Hello, my name is Dara Wallinger, and today I'm here to talk about the opiate crisis and the crisis within our communities. So, the opiate crisis is serious health crisis. It is truly considered an epidemic at this point, and that is according to the CDC. According to the CDC, the epidemic has caused more than 70,000 overdose drug-related deaths here in the United States. It is also marked the number one leading cause of drug-related deaths. The misuse and addiction to the opioids, including prescription pain meds, heroin, and synthetic fentanyl, are responsible for these crises within the community. According to the National Institute of Drug Abuse, the opioid overdose and pandemic has affected both our public health, social, and economic welfare. The crisis has left the economic cost of $78.5 billion to the U.S. These costs include healthcare costs, treatment programs, lost productivity, and even criminal justice costs. The crisis has had a serious consequences on infectious diseases such as HIV, Hep C, because of the increased injection use. Also seen as an increase is in the neonatal abstinence syndrome, which occurred when opioid use was used during pregnancies. Next, I would like to transition to discuss what each and every one of us can do to treat this horrible crisis. The University of Rhode Island's College of Pharmacy instituted a first responder community program online training course to the local communities. Upon completion of the course, you receive a free Narcan spray and free fentanyl test strips, and they will be mailed to you upon completion. The course teaches us how to recognize drug overdose. Some of the symptoms could be unresponsiveness, unconsciousness, bluish colored skin, cyanosis, constricted pupils, slow or stop breathing, which would be considered bradypnea. And the next thing the course does teach us is how to identify the risk factors involved in a person's increased chance of a bad reaction to the opioids. This can include a history of substance abuse. It could include a long time pain management, taking opioids and other drugs like benzodiazepines, and also ETOH, which is alcohol, certain medical conditions like asthma. All of these can increase the risk for a bad reaction, often leading to the overdose. The next thing the first responder course teaches us is how to respond to the drug overdose. The first thing that we're instructed to do from the course is to call 911 immediately. Try to wake the person. Do a sternal rub. Call their name. If they're not responsive, you can start to administer the Narcan. Because the Narcan is an opioid antagonist, it's only going to bind to the opioid receptors, and it is not going to harm you if it wasn't an overdose. The second thing the first responder course training tells us is to begin rescue breathing. So with that, you pinch the nose, use a mouth shield if you have one, and begin. It's one breath per 5 seconds until help comes. So what I'd like to do now is I would like to start and show you how Narcan is going to be administered. And so what I want to do is discuss just a little bit about how and when to administer the Narcan. The first thing we do is we're going to administer the Narcan if a person is unresponsive, when all the signs and symptoms point to a overdose, and we're going to administer Narcan after we call 911. And then the next thing we're going to do is I'm going to show you how to administer the Narcan. So the first one I have is this would be something that you've probably seen before, and this is the nasal spray. This is 4 milligrams, and it's 1 spray per device. So I'm not going to open this, but all we do is take this, inject up into the nares, and you'll be done. The next one I can show you this is a little bit different type. It's actually a pre-filled syringe. You can see this here. Pre-filled. It's naloxone hydrochloride. So it's a pre-filled syringe. I'm going to take this and get it out of the box here. Okay, so here's it's two parts. Okay, I don't know if you can see this. Let me back up. There you go. Okay, so you're going to take the cap off of this. Yellow cap, yellow base. Bear with me. Okay, yellow cap, yellow base is off of this. And you're going to take the purple cap off of this. This is actually where the drug is. You take the purple cap off. I'm just going to put it back on so we don't use it up. And you're going to take this. You're going to twist it. Twist. Twist gently. Okay. And then we get our atomizer for the top. This screws right on here. So what you do is you want to try to get half of this in one nares, half in another. So you're going to go up, you're going to push, firm push. You want it very firm and steady, not slow. You want it fast so it has a misting. Otherwise, if it's too slow, you'll just get like droplets and it won't be effective for the patient. So you're going to do half in one nares, half in the other nares. And then that's it for this one. So I've showed you now 2 applications. And so hopefully help is on their way. So in conclusion to this presentation, I would like to say that by learning this first responder training course, that we should all become a true first responder, community responder, and we should always remember that Narcan can truly save a life. Thank you very much.